Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's focus on the types of hypersensitivity. So the first one is, we are just focusing on the important ones. The first one, in brief, is the type 1, it's IgE mediated. So the clinical symptoms involves the anaphylaxis and the atopy, and the time of manifestation is minutes. The mediators involves the IgE, histamine, as well as the pharmacological agents. The site 2 is the cytolytic as well as the cytotoxic. And the clinical syndrome is the antibody mediated damage. Antibody mediated damage. That is the thrombocytopenia, the hemolytic anemia, a granulocytosis. The time of manifestation will be hours to days. And mediators are the IgG as well as the IgM. Now type 3 involves the immune complex. So they involve the Arthur's reaction as well as the SS, that is the serum sickness. So the time for manifestation will be hours to days, and the mediators is IgG, IgM as well as the leukocytes. Then moving on to the type 4. Type 4 is nothing but the delayed hypersensitivity. So the clinical symptom involved will be the tuberculin. So it involves the tuberculin as well as the contact dermatitis. So manifestation will be hours to days, and the mediators are the T cell, lymphokines as well as the macrophages. To learn and grow daily like this, please do subscribe.